This video demonstration will review the steps necessary for making a bone-level implant impression using the open tray or direct pickup technique. A Dentium Superline 2 implant will be used for this example. Please note that the closed tray or indirect transfer impression technique is covered in a separate video. The implant interface is common across all lengths and diameters of the implants in the Superline 2 product line, so the restorative clinician can be confident that all impression and prosthetic components will fit into each implant, no matter the implant size. In addition, there is only one implant analog to choose from the catalog, which is universal and is used for all implants in the entire Superline 2 product lineup. Select an open tray impression coping from the catalog of the appropriate dimensions. The clinician has options to choose either a short or long coping length, a hexed or non-hexed interface, and 4 different emergence profile diameters. 2 of them are pictured here. A short coping may be more applicable for posterior applications or in patients with limited mouth opening, whereas a long coping may be better for anterior applications or in regions where a taller impression coping screw is needed to protrude past the incisal edges of the adjacent teeth. A hexed or engaging interface should be utilized for single unit prosthetics, such as a single unit crown, where implant timing is crucial to record. Non-hexed or non-engaging impression copings should be reserved for applications where implant timing is not critical to record. For example, bridge or full arch prosthetics, provided that non-engaging prosthetic interfaces will be utilized in the final restoration. The 4 emergence profile diameters of the impression copings have been designed to match the 4 emergence profile diameters of the healing abutments. Although it is not critical, at the time of implant placement, if the surgeon chose the healing abutment diameter to match the proposed cervical diameter of the future restoration, then the restorative clinician could select the diameter of the impression coping based on the diameter of the healing abutment that was used. A wider impression coping could be used where a wider healing abutment was chosen, for example in a molar site, whereas a narrower impression coping could be used where a narrower healing abutment was chosen, for example in the premolar or lateral sites. For this video demonstration, an implant level impression of site number 9 will be made. A decision-making process for the selection of the open tray impression coping could proceed as follows. First, for choosing a coping height, a tall coping will be chosen so that it can protrude past the incisal edges of the adjacent teeth. Second, for choosing the interface, a hexed or engaging interface will be chosen so that the implant